Welcome. My name is Jessica Joyce. I'm a public health nurse working for the immunization program in the McHenry County Department of Health. And thank you for having us here today. When we think of vaccines, we usually envision children getting their back-to-school shots or getting our kids up to date at their yearly well exams. Many adults don't think about the vaccines that are needed after school ends and do not realize that vaccines in adulthood are just as important as they are in childhood. I'm here today to talk with you all about why vaccination is important in adulthood, which vaccines adults should be up to date on, and how these vaccines will help prevent and spread vaccine-preventable illness. So what are vaccines exactly? The U.S. Department of Health and Human Services defines the term vaccine as a product that produces immunity from a disease and can be administered through needle injections, by mouth, or by aerosol. They also define the term vaccination as the injection of killed or weakened organisms that produce immunity in the body against that organism. So basically, vaccination is the act of receiving the product, which is the vaccine. Finally, the U.S. Department of Health and Human Services defines the term immunization as the process by which a person or animal becomes protected from a disease. Vaccines cause immunization, and there are also some diseases that cause immunization after an individual recovers from the disease. This describes what the product does in the body after the act of injection, ingestion, or inhalation of the product. So now that we know about or know what vaccines are, let's see how they work. I want everyone to be honest. Raise your hand if you know exactly how vaccines work in the body. Okay, which is fine. Many adults have no idea how they work in the body, and which does not help vaccination rates and only increases the skepticism regarding immunizations. Vaccines were created to mimic an infection to create immunity without causing illness. Typically, when a virus or a bacteria enter the body, they reproduce thousands and thousands of times, causing acute illness. Because a vaccine is made from a portion of a virus or a bacteria that is weakened, it may only reproduce under approximately 50 times, thus not causing an illness. When the body recognizes any virus or bacteria, it triggers the immune system to produce antibodies. These antibodies are produced for as long as the host has the acute infection. Once the infection is over, the body stores these antibodies as memory cells, and that will jump into action once the body recognizes that specific virus or bacteria again. This is how immunity works. When a vaccine is injected into the body, it will mimic an infection in order to create those antibodies to be stored for a later exposure. Because the body recognizes that a virus or bacteria has entered the body, whether it's from the vaccine or the disease itself, the body will create minor symptoms such as a fever while the body is building the immunity. This will occur with about any vaccine, and is why a low-grade fever is one of the most common side effects of vaccine administration. Now, vaccines are not 100% effective in creating long-term or lifelong immunity in every person, but it can create enough immunity that if a vaccinated person were to be exposed to a vaccine-preventable illness, they may experience very mild form of the disease. For example, if someone was diagnosed with chickenpox, but they've had their recommended doses of chickenpox, the disease will not be as severe as it would be if they weren't vaccinated at all. So they may not have as many lesions across the body, they may not have a fever, or they may not feel sick at all. Immunity is created from vaccines and is no different than immunity created from the disease itself. I had chickenpox when I was 5, and I have lots of scars to prove it. And then a year later, my sister was born, and she ended up getting the full vaccine series. We've both been exposed to chickenpox in the past, and both of our bodies have been able to fight it off equally. Did you know that up to 49,000 people die each year in the United States from influenza? Did you know that each year in the United States, pneumococcal disease causes more than 1 million cases of pneumonia and thousands of cases of sepsis and meningitis? Did you know that before the hepatitis A vaccine was introduced in the US, more than 250,000 people were infected every year? Did you know that there is an estimated 2.2 million people in the US who are chronically infected with hepatitis B virus? Or about hepatitis B is 100 times more infectious than HIV? That sounds like a lot of sick people. And if there's a vaccine for all these illnesses, why are so many people still getting sick? Well, there's a few factors as to why adults are not vaccinating. Skepticism regarding vaccine safety and effectiveness accounts for a majority of the lack of immunizations amongst adults. Many adults do not have the ability to pay for vaccines without insurance. Even with the Affordable Care Act in place, there is still some policies that do not cover vaccines, including parts of Medicare. Lack of public knowledge regarding the adult immunization schedule and the risks and the consequences of vaccine-preventable diseases is also a factor. The lack of awareness that adults are supposed to receive vaccines other than the flu plays a big part as well. Conflicting and inaccurate information about immunizations among the media and the internet is also another factor. This ties into skepticism because adults start becoming skeptic of vaccinations after reading blog posts or talking to friends who heard from other friends and so on and so forth. This is a large factor in not only amongst adults but children as well. It is always important to retrieve your information from a trusted source such as the CDC and their affiliates. And then also, of course, adults, we forget about vaccines. For some, just hearing the statistics is reason enough to get their recommended vaccines, but for others, the National Foundation of Infectious Disease has put together 10 reasons why it's important to vaccinate. Number 1, vaccine-preventable diseases have not gone away. The organism that causes illness and death still exists and can be passed on to those who are not protected by vaccines. In a time when people can travel across the globe in just one day, it is hard to see how easily disease can travel. Skeptics have also helped bring back previously declining diseases such as whooping cough and measles. Number 2, vaccines will help keep you healthy. The CDC recommends vaccinations throughout your life to protect against any infections and diseases. When you skip vaccines, you leave yourself vulnerable to illness, such as HPV and hepatitis B, both leading causes of cancer. Vaccines are also important to your overall health, which is number 3, as diet and exercise. Like eating healthy foods, exercising, and getting regular checkups, vaccines play a vital role in keeping you healthy. They're one of the most convenient and safest preventable care measures available. And then number 4, vaccination can mean the difference between life and death. Vaccine-preventable infections are dangerous, and every year approximately 50,000 U.S. adults die from a vaccine-preventable disease in the U.S. Number 5, vaccines are safe. The United States has the best post-licensure surveillance system in the world, making vaccines extremely safe. There is extraordinarily strong data from many different medical investigators, all pointing to the safety of vaccines. In fact, vaccines are one of the safest products in all of medicine. Number 6, vaccines won't give you the disease they are designed to prevent, which is a huge one amongst a lot of people. You can't catch the disease from the vaccine. Most vaccines contain a killed virus or bacteria, and it is impossible to get the disease from that vaccine. Other vaccines do have live viruses in them, but they're weakened. So the viruses are designed to ensure that you cannot catch the disease. Number 7, young and healthy people can get sick too. Infants and elderly are at a greater risk for serious infections and complications in many cases, but vaccine-preventable diseases can strike anyone. If you're young and healthy, getting vaccinated can help you stay that way. Number 8, vaccine-preventable diseases are expensive. An average influenza illness can last up to 15 days, typically with 5 to 6 missed work days, while adults who get hepatitis A can lose an average of 1 month of work. Number 9, when you get sick, your children, grandchildren, and parents are sick too. A vaccine-preventable disease that might make you sick for a week or two could prove deadly to your children, your grandchildren, or even your parents if it spreads to them. When you get vaccinated, you're protecting yourself and your family. For example, adults are the most common source of pertussis, which is whooping cough, infections in infants, which can be deadly for the infants. Number 10, your family and coworkers need you. In the U.S. each year, millions of adults get sick from a vaccine-preventable illness, causing them to miss work and leaving them unable to care for those who depend on them, including their children and or their parents. As adults, it is important that we keep ourselves up to date with recommended vaccines according to the CDC adult schedule. Because many of those in the audience today have not received as many vaccines as their children or their children's children, and because the immunity developed from the vaccines that you've received in childhood can wear off over time, it is important to stay up to date. All adults are recommended to receive a yearly influenza vaccine as well as a tetanus booster every 10 years. It is also recommended to receive additional vaccines for adults based on their age, health conditions, their job, their lifestyle, and travel habits, according to the CDC. For example, a pregnant woman at as early as 27 weeks gestation is recommended to get 1 dose of the Tdap vaccine, which contains tetanus, diphtheria, and pertussis, but mostly for the pertussis component. This is a recommendation for each pregnancy due to protecting their newborn infant from pertussis, aka whooping cough, which has also has been on the rise in McHenry County alone within the last 10 years. There may be additional vaccines recommended based on your current health conditions, such as type 1 and type 2 diabetes, as well as any condition that has compromised your immune system. You can refer to the backside of your CDC handout or schedule for more information about what would be needed for your condition. Healthcare workers are also at risk for exposure to deadly disease. It's recommended for healthcare workers to have direct care with patients or handle material that can spread disease are as followed, like hepatitis B, MMR, varicella, which is chickenpox, or even meningitis. Some facilities who require these vaccines in adults will accept immunization records stating that the healthcare worker was immunized in the past. Some will require proof of immunity in addition to the record. It is important to talk with your facility on what is required for employment. If you're traveling internationally, it's recommended to see your healthcare provider to determine if you are up to date with any vaccines that maybe have missed. You can also refer to the CDC travel health website for recommended vaccines or medications. It is then recommended to get any vaccines warranted for your particular area of travel within 4 to 6 weeks before leaving for the trip, just to help build up the immunity before you actually leave. Just like traveling out of the U.S., the CDC recommends that any immigrants or refugees are vaccinated according to the Advisory Committee of Immunization Practices, or the ACIP recommendations. These recommendations are based on immigrant and refugees' age, health condition, job, and other risk factors. This recommendation is in place mainly because most of the diseases that we vaccinate in the U.S. for and that we're not seeing a lot of are still very prevalent in other areas of the world. As with any medical decision, it's always advised to speak to or with your healthcare provider regarding which vaccines are recommended for you. So what are the most common adult vaccines? Just like with our children, adults have their very own immunization schedules and recommendations. Most vaccines are recommended for children, are also recommended for adults. Many of you in the audience didn't receive most of these vaccines as children, which is another reason why vaccinating is so important. The tetanus vaccine is recommended every 10 years. The Tdap with the pertussis is recommended every 5. In adults 65 years and older, the CDC recommends receiving the pneumococcal vaccine, which helps protect against pneumococcal disease such as pneumonia or other infections in the blood. The pneumococcal vaccine is only recommended in those with certain chronic health conditions in adults between 60 and 64 years old. In adults 60 years and older, the zoster vaccine is recommended by the CDC. This vaccine helps protect those against shingles, which is a form of varicella or chickenpox that exacerbates later in life. And if anyone in the audience has ever experienced shingles, you know how painful and debilitating it can be. The HPV vaccine is recommended for adult women up to the age of 26, adult men up to the age of 21, and adult men up to 26 who have sex with men. Other adults amongst this age group, 19 to 26, are recommended to receive other vaccines such as the meningitis vaccine, and a lot of the meningitis vaccines are now becoming required for adults to register for colleges and university, and that's at any age. Yes?
How long is the pneumonia vaccine good for?
Well, I am going to go over that in just a couple of slides, so give me just a little bit. The meningitis vaccine is recommended for adults 19 to 23 years of age, as they are higher at risk. Adults living in close quarters with other adults are susceptible as well. Hepatitis A is recommended for adults who plan to travel outside the U.S., healthcare personnel, and IV drug users, while hepatitis B is recommended for adults who are IV drug users, sexually promiscuous, healthcare personnel, diabetics, and those receiving hemodialysis. The influenza vaccine is recommended every year, and the reason for that is because the vaccine is made up of different influenza strains, usually 3 to 4 of both type A and type B. These vaccines are always recommended for those who have weakened immune systems or are susceptible to infection. Talking with your healthcare provider will help determine what vaccines you should and shouldn't receive. So now I'm just going to go over some of the diseases that we vaccinate for and some of the vaccines. So the first one is the TD, or the Tdap. The CDC recommends that every adult receive their tetanus shot every 10 years. Tetanus is a serious disease that affects the nervous system and is caused by exotoxins produced by a bacterium. It's not contagious and cannot be spread from person to person, fortunately. But the bacterium typically thrives without oxygen for years in soil, in dust, and animal feces, and usually it enters the body through a break in the skin. The bacteria produces a toxin that blocks nerve impulses that allow the muscles to relax, creating a generalized tetanus, which is the most common form of the disease. Generalized tetanus is as descending symptoms of lockjaw, difficulty swallowing, muscle rigidity, and spasms. Even with proper treatment, it is fatal in 10 to 20% of those who are infected. Between 2009 and 2014, approximately 18 to 37 cases were reported annually in the U.S. Most cases occur in adults 40 years and older due to the decline in tetanus boosters. But there's been a recent rise in tetanus amongst younger adults due to IV drug use. Diphtheria is a highly contagious disease caused by a bacterium, and it usually infects the nasal cavity and less commonly the skin. Majority of infected persons house the diphtheria bacteria in their nasal cavity, transmitting the disease through respiratory secretions. Severe complications include swelling of the neck, also known as bull neck, difficulty breathing, damage to the heart, neuritis, coma, and death. Diphtheria's mortality rate is 5 to 10%, with rates up to 20 in children under 5 and adults over 40. Before the development of the vaccine, diphtheria claimed 15,000 lives yearly in the U.S., while infecting between 100,000 and 200,000 yearly. Between 1980 and 2013, only 56 cases were reported in the U.S., and only 7 probable or suspected cases have been reported since the year 2000, which is pretty good. Though the U.S. has seen so very few cases of diphtheria recently, it's still a threat to travelers, though. Cases around the globe have declined from 11,600 in 2000 to 4,600 in 2013. And pertussis is a highly contagious disease. It's also caused by a bacteria, and it's transmitted through the respiratory secretions. Symptoms are very similar to those of a cold, but can progress into a severe cough with a whooping sound, hence the common name of whooping cough. These coughing spells can become so severe that those infected have difficulty eating, breathing, and drinking, and can last for weeks, which can lead to pneumonia, brain damage, seizures, and even death. Pertussis was the most common cause of death among children before the vaccine. Between 1940 and 1945, over 1 million cases were reported, which averaged approximately 175,000 a year. After the introduction of the vaccine in the 1940s, incidence of disease gradually declined, and by 1970, an annual incidence was fewer than 5,000 cases per year, and by 1990, incidence dropped to under 3,000 yearly. But in 2004, almost 26,000 cases were reported. the largest number of reported pertussis infections since 1959. And by 2014, almost 33,000 cases and 9 deaths were reported in the U.S. It's recommended for adults to receive the Tdap vaccine if you or anyone close to you becomes pregnant or if you will have any regular contact with infants. This recommendation is to help protect the infants from pertussis, as they are the most susceptible to this disease. And the Tdap and the TD, the protection decreases over time. Some people may be protected for life, but most of them have an antitoxin levels that only approach the minimal protective level up to 10 years from your most recent dose. This is why there's a recommendation for a booster every 10 years, but for pertussis is every 5 years. In 2014, of adults aged 19 to 64, only 20% received their pneumococcal vaccine, and these are high-risk populations for invasive pneumococcal. In the same year, 61% of adults aged 65 years and older received their pneumococcal vaccine. Pneumococcal is caused by Streptococcus pneumoniae bacterium. There are 92 different strains. The 10 most common strains make up for more than 62% of all invasive diseases worldwide. Most commonly affects our upper respiratory tract without causing any illness. Up to 90% of healthy people are carriers of pneumococci, which puts others who cannot vaccinate due to an illness at higher risk. Among persons 65 years and older, incidence of invasive pneumococcal decreased about 50% from 61 per 100,000 population in 1998 to 31 per 100,000 population in 2013. Adults with certain medical conditions are at higher risk. Pneumococcal disease has been found to have some strains that are resistant to antibiotic use, which makes it even more important to vaccinate. There are 2 different types of pneumococcal vaccines. There is pneumococcal vaccine 13, which is also known as Prevnar, and then there is pneumococcal polysaccharide vaccine 23, which is usually known as Pneumovax. Prevnar is most commonly used in healthy children and adult. It contains 7 strains that accounts for 83% of bacteremia cases and meningitis cases. 6 additional strains include strain 19A, which has emerged as the most common cause of invasive pneumococcal disease in all age groups over the last 10 years. Prevnar is a single dose for healthy adults with no history of record of previous vaccinations. So to answer your question, you only need 1 dose, but I would speak to your healthcare provider just to make sure that you don't have any conditions that would warrant you for an additional dose.
Is there a titer for immunity?
For the pneumococcal, I'm not sure. I'll have to look that, and I'll get back to you on that one.
Who would get the 23 then?
I'm going to go right into that right now. Pneumovax is recommended for those at increased risk for pneumococcal disease, such as those with chronic conditions or who's immunocompromised. And the top 23 most common of pneumococcal bacteria that causes 60 to 76% of invasive disease. Overall, Pneumovax is 60 to 70% effective in preventing invasive disease caused by the included strains. Pneumovax is a single dose for at-risk adults, but can be given again within 1 to 5 years, depending on your immune system. I would speak with your healthcare provider regarding the vaccine, which one would be right for you. Typically, in order to get the 23, you have to have already had the 13 within at least 8 weeks. So I would talk to your doctor and see if they would suggest you get the 23 or just stick with just the 13. Excuse me. Herpes zoster, or shingles, is a painful rash of blisters that usually develops on one side of the body, oftentimes the face or the torso. If you had chickenpox as a child, which majority of us have, you run the risk of developing shingles later in life. According to the CDC, shingles is an exacerbation of the varicella virus, more commonly known as chickenpox. Anyone that was exposed to varicella, regardless of your age, runs the risk of herpes zoster outbreak. The CDC states that after the primary infection of varicella, the virus lays latent in our sensory nerve ganglia and can reactivate at a later time to cause herpes zoster. The CDC has said that herpes zoster cases have been reported among vaccinated persons, but not all of these cases have been confirmed as having been caused by the vaccine. Either way, the risk is lower than if primary infection was from wild-type varicella virus. The only vaccine approved in the U.S. has shown to reduce the risk of developing shingles by 51% and post-herpetic neuralgia, which is a condition of long-lasting pain due to herpes zoster, by 67%. In 2014, in adults aged 60 to 64, only 31% received their shingles vaccine. Only 20%, and then 31% of 65 years or older. The CDC is recommending any adults 60 years or older should receive 1 dose of the zoster vaccine, regardless if they've had prior outbreaks or not. Your risk for developing shingles runs higher the older you get. This is why it's important to talk with your healthcare provider about the vaccine and when you should receive it. The human papillomavirus is composed of more than 200 strains of the HPV viruses, most strains infecting the skin and causing common skin warts. More than 40 strains of the virus pass from contact to contact via sexual or intimate contact and infect genital areas of both men and women, and can also be passed through oral sex and genital-to-genital contact. The HPV vaccine, Gardasil, protects against 9 different strains of the human papillomavirus, 7 of which are cancerous strains. These infections are associated with cancers of the following: cervical, vulvar, vaginal, penile, anal, and oropharyngeal, which would be mouth or throat. HPV is believed to be the most common sexually transmitted infection in the U.S. Currently, an estimated 79 million people are infected, and an estimated 14 million new HPV infections occur annually, with half in persons 15 to 24 years of age. HPV is responsible for 91% of anal cancers, 75% of vaginal cancers, 70% of mouth and throat cancers, 69% of vulvar cancers, and 63% of penile cancers. Almost all sexually active individuals will get HPV at some point in their lives. Though most will never even know it, most infections show no symptoms at all and resolve spontaneously. A small portion of the infected persons become persistently infected and can be infected with multiple HPV strains at once. An estimated 4,000 women die yearly from cervical cancers. From 2008 to 2012, in the U.S., an estimated 30,700 HPV-attributed cancers diagnosed annually and in women and men, and included 10,700 cervical cancers. HPV is believed to be responsible for up to 91% of all cervical cancers. There's two strains that are responsible for approximately 70% of all HPV cases, cervical cancer cases, which are strains 16 and 18. These 2 strains are also responsible for a majority of the other cancers shown above. In 2016, a study showed that within 6 years of the HPV vaccine introduction, vaccine type prevalence decreased 64% among female teenagers 14 and 19. Other studies show that the HPV vaccine prevents nearly 100% of precancer cervical cells caused by the strains of HPV targeted in the vaccine for up to 4 years. For the HPV vaccine, more than 99% of vaccine recipients developed antibodies to the HPV within 1 month of completing the series. For women, yearly detection is vital, and screenings are still recommended in the vaccinated. The CDC recommends for women over the age of 26, the best protection against any HPV-related cancers is to visit your doctor for regular screenings. Unfortunately, there is no test for HPV for men. Meningococcal disease is an acute, potentially severe illness caused by a bacteria. Ultimately, meningitis is the inflammation of the meninges, which are sheaths that protect our brain, between our brain and our skull. There are 12 known serogroups of the bacteria, in which almost all invasive disease are caused by serogroups A, B, C, Y, and W. Meningitis is spread through person-to-person contact through aerosolized droplets or secretions from the respiratory tract of an infected person. Those most at risk for meningitis are those who are in close contact with an infected person. Studies have shown that it is common for transient asymptomatic meningitis in some populations, such as environments where there is crowding, including military barracks and college dorms. As many as 10% of adolescents and adults are asymptomatic transient carriers of the meningitis bacteria, but only a small amount of people who are carriers, less than 1%, actually develop invasive meningitis. In these persons, the organism penetrates the mucosal cells and enters the bloodstream. The bacteria is then spread to other organs through the blood. In about half of the bacteremia persons, the organism crosses the blood-brain barrier in the cerebral spinal fluid and causes meningitis. Meningitis can be caused by a number of different bacteria, viruses, and fungi. Serogroups B, C, and Y are the major causes of meningitis in the U.S. Adolescents 16 to 23 have the highest rates of meningitis, but it is still common in those who are 65 years and older. In 2013, an estimated 70 deaths due to meningitis occurred in the U.S. The case fatality rate for invasive meningococcal disease is 10 to 15%, even with appropriate antibiotic therapy. As many as 20% of survivors have permanent effects such as hearing loss, neurodamage, or a loss of a limb. There are 2 meningitis vaccines currently available in the U.S., one that protects against serogroups A, C, W, and Y, and one that protects against serogroup B. Indication for vaccinations are different for each type of vaccine. For example, there's one called Menomune. This one protects against A, C, W, and Y, and it's recommended only for the use in certain persons 56 years or older who are at increased risk for the disease, usually if you have a chronic disease or if you're immunocompromised. There are 2 meningitis B vaccines, Bexsero and Trumemba. They may be given to anyone 16 to 23 years old to provide short-term protection against the most common strain, which is serotype B. It is not recommended for healthy persons who are not at increased risk for exposure after the age of 21. However, certain groups of adults at increased risk of disease should receive the vaccine, including travelers to or from countries where disease is common. Right now, the sub-Saharan region in Africa is dubbed the meningitis belt because there's a huge outbreak going on right now over there. Also, those identified to be at higher risk due to an outbreak: first-year college students living in a dorm and military recruits living in barracks. In 2014, a total of 1,239 hepatitis A cases reported from all 50 states, a 30.4% decrease from 2013. Rates were highest in adults 20 to 29 years old. Historically, children under the 18 have had the highest rate of hepatitis A, but since 2002, rates in children have declined and rates in adults have increased. Hepatitis A is most commonly transmitted through food. The virus enters the body through the mouth and replicates in the liver. Transmission occurs mainly when a person puts something in their mouth that was contaminated with stool from an infected person. Therefore, hepatitis A spreads most easily when sanitary conditions and personal hygiene is poor. Hepatitis A can be transmitted through contaminated food and water, so washing your hands and any contaminated surfaces after using the restroom is the best way to prevent transmission. There is no specific treatment for hepatitis A once infected. Most recover with supportive care. Hepatitis A usually doesn't last any longer than 2 months, but 10 to 15% do have prolonged or relapsing signs and symptoms up to 6 months. Fulminant or quick rapid onset of hepatitis A is the most severe complication, with mortality estimates up to 80% among those older than 40, occurring most often in the older people. There are 2 licensed hepatitis A vaccines for use in the U.S. Hepatitis A vaccine was first introduced in 1996, and it was initially targeted at international travelers. In 2005, hepatitis A vaccination became universal for all children 12 to 23 months of age. More than 95% of adults will develop a protective antibody within 4 weeks of a single dose of the vaccine, and nearly 100% after the second dose. A recent study states protective levels of antibodies of hepatitis A could be present for at least 25 years in adults. Hepatitis A is recommended the vaccine is recommended for certain high-risk groups, such as anyone traveling outside the U.S. or plan to adopt internationally should review the CDC's health travel website for more information or discuss it with your healthcare provider. Men who have sex with men, users of injection drugs, and persons with other chronic conditions. Interesting enough, hepatitis A vaccine is not routinely recommended for food handlers, attendees, or employees of daycare centers, healthcare professionals, or wastewater workers. Hepatitis B is a serious liver disease caused by the hepatitis B virus. The infection can cause acute illness as well as chronic hepatitis and cirrhosis. It is the cause of up to 50% of all liver cancers. Estimated 2 billion people worldwide have been infected with hepatitis B, and more than 240 million have chronic lifelong infections. The World Health Organization is estimating that about 780,000 people will die worldwide each year due to the consequences of Hep B infections such as liver cancer and liver cirrhosis. It's transmitted by mucous membranes exposed to the body fluid from an infected person, but the highest concentration of the virus is in the blood, the serous fluids such as saliva, tears, urine, and semen. Hepatitis B can be transmitted through several routes, such as unprotected sexual contact, percutaneous, so any kind of needle stick or even a bite, contamination of mucosal membranes from infected fluids splashing in the face, or if you have it on your hand and you touch your mouth or your eyes, and peritoneal transmission from mother to infant at birth. Hepatitis B virus can remain infectious for at least 7 days on environmental surfaces and is transmissible in the absence of visible blood. Most infections in adults result in complete recovery, but in an adult who has a fulminant hepatitis B virus infection, which is where the infection comes suddenly, rapidly, and with great intensity. This occurs about 1% to 2% of the time and has a mortality rate up to 93%. In the U.S. in 2013, an estimated 19,800 new cases of hepatitis B occurred, and there is up to 1.4 million people chronically infected. Some risk factors may include use of injection drugs, healthcare personnel, having unprotected sex, residing or working in an institutional setting, having certain chronic conditions, and immigrants from areas with high rates of hepatitis B infection. Risk increases with increasing number of years of high-risk behavior or exposure. About 40% of injection drug users will become infected with hepatitis B after 1 year, while more than 80% are infected after 10 years. The hepatitis B vaccine that is currently used in the U.S. was licensed in 1986. It's a 3-dose series. More than 90% of healthy adults develop adequate antibody responses after a completion of the series. By 60 years, only 75% of recipients respond after completion of the 3-dose series. Immune memory remains intact for 30 years or more, even if antibody levels are declining over time. This is why a booster is not recommended after immunity has been achieved. Influenza is recommended for all persons 6 months or older on a yearly basis. Influenza vaccines are typically available between September through April, though there are some facilities that if they get the vaccine early enough, they'll start giving in August. The CDC advises that those who should not receive the influenza vaccine are those with severe life-threatening allergies to the flu vaccine or any of its components. They go on to state that this might include gelatin, antibiotics, or other ingredients. The CDC recommends you talk with your primary healthcare provider if you have an allergy to eggs or any of the ingredients in the vaccine, if you've ever had Guillain-Barré syndrome, and if you are not feeling well. Just talk with them about your symptoms and see if they would suggest you getting the vaccine. So there has been some recent outbreaks in 2017 alone. Hepatitis A, there's a huge outbreak in Southern California right now. Last I checked, up to 15 people have died. Over 300 people were confirmed infected with hepatitis A, and over 250 have been hospitalized. Now this is they found a source through contaminated papayas, and then also within the homeless population, mostly in the urban areas such as San Diego or Los Angeles. So California state health officials have decided that they're going to put more hand washing stations and try and build as many more homeless shelters as they can to try and help prevent them from being more homeless being infected. There's also been measles outbreaks. I'm sure most of you guys have heard about this in the news within the last couple of years at Disney World, Disneyland. I know recently there was a daycare in the area that there were a few cases there, and then most recently in Minnesota, there was a huge outbreak out in Minnesota. So far, since January 1st to August, more than 118 cases have been reported of measles, and Minnesota being the hardest hit, where they had 79 confirmed cases. Most of those were of the unvaccinated and immigrants from Somalia, or from Somali. There's also been, I'm sure some of you have heard, a few months ago there were some confirmed cases of mumps in Lake County and McHenry County this year, which infected children as well as adults. From January 1st through August 12th, there has been 4,420 confirmed cases of mumps in the U.S. A preliminary count done by the CDC estimated over 11,000 cases of pertussis in the last year. That is an increase of over 2,000 from the year before, which was the highest in the last 30 years. As you can see, outbreaks are happening in the unvaccinated as well as the vaccinated, which is another point why to get your boosters and keep up to date. And immunizations rates in adults is a contributing factor. So where do you get vaccinated? Well, I would start off with your primary healthcare provider, talk with them about what vaccines they think you should receive, and if they can do them in the office. If they can't, most retail clinics or pharmacies have most of these vaccines and vaccinate adults. Usually you can do it through they'll accept your insurance and submit and go from there. If that's not an option for you, a lot of workplaces do offer some of the vaccines. If not, we are available. We can help. McHenry County Department of Health, we have some adult vaccines, but if you give us a call and let us know what you've talked with your doctor about and which vaccines they are saying that you should have or that you are recommended for, then give us a call and we'll try and help you out and let you know if we can give you the vaccine. Does anyone have any questions? Yes.
I keep seeing in the news that baby boomers should look up Hep C vaccination.
There's no vaccine for hepatitis C, only hepatitis A and hepatitis B, but the baby boomers, you're right, they are targeting baby boomers for hepatitis C.
But it's to get tested.
Yeah, to get tested for it, yeah.
It's because it takes so long to develop hepatitis C,
Mhm.
like 15, 20 years after your exposure, that finally like your liver enzymes are out of whack on your testing and you go get tested in the next.
Anyone else have any questions? Yes.
I think I missed it. If you said, how long is the pneumonia shot good for?
You only need to get one. Just the one vaccine, but like I stated before, depending on what your doctor feels is right, you could either get the Prevnar, which is the 13, and then 8 weeks later get the 23, if your provider feels that you have a chronic condition that you would benefit from that.
So that's just once in a lifetime?
Yes.
Once every
Yep, as an adult once.
Once in a
Mhm.
lifetime.
Yep. Yes.
Do they do the meningitis one for high school kids or is it just college kids?
Nope, they do it for, there is one that we start vaccinating at 11. We start recommending vaccination at 11. Actually, the Illinois, or state of Illinois has made it a requirement to enter 6th grade. You have to have at least one at 11 years old of a meningitis vaccine, and then again a second boost or a booster, second dose at 16 or before they enter senior year. So our kids are getting vaccinated in school before they go off to college, and that's to protect them through 11 through high school, and then get their booster to protect them through college.
Is that a new one, the age 11 thing?
Within the last couple of years, it's almost 3 years that it's been a requirement.
Okay.
And then there's another one, meningitis B, that one's required for high schoolers that are going into, it's not required, I'm sorry, it's recommended for high schoolers going into college. Yes?
It's shingles shot, that's a live virus, right?
I think if it's alive, it's weakened.
But I mean, I've heard people getting the shot and actually getting it, so then I'm wary of it.
Yeah, which I understand. I would talk with your doctor about it and see if it's something that they would recommend you doing. A lot of the times, a shingles outbreak can come up about through stress, and sometimes having a shot or having the vaccine can cause stress on the body, which can exacerbate it. But I would speak with your healthcare provider about it before, definitely before getting it.
I had one say yes, I had one that said no, so.
Oh, what, doctors? Oh. Yeah, that's, maybe get a third one and see who breaks it. Yes.
Is there a new flu vaccine out for seniors over 65? Like a booster?
Isn't there like a super flu one? There's
Right.
like a flu and then a super flu one. I've heard about this before.
Oh,
It's
no.
recommended for people over 65 to get that one. I think it has more strains in it.
Okay.
It's not something the health department carries.
Yeah.
No, I know
I haven't heard about that, but I'll definitely look more into that.
Well, I just know because a lot of people with chronic illnesses are recommended to get that. And I get asked every year, do we have both flu vaccines? Or do we just have the regular ones?
Yeah, there is, because I know my mom's got it.
Okay.
But it probably has more limited availability in regards to who's gonna carry that. And then it could even be even what insurance will cover the 65 plus recommended dose.
Anyone else? Yes.
Just this past year, we are aware of someone whose little 10-year-old brother got bacterial meningitis, and how would he have caught it? Yeah.
Easily. I mean, he could have shared a drink with a friend. That's why we start with meningitis vaccines. The state's required to start at 11 for schools, because around that age is when kids start to become more independent. They're not with mom and dad more often. They're hanging out with friends, riding their bikes places. So they're doing things that they normally wouldn't do if they were with their parents. So that's why they've started requiring it for starting at 11 years old, so that they're protected from then up until high school, and then they get their booster to go through college.
Really, did you say some people are carriers of the pneumo? Yeah.
The pneumococcal, yeah, and up to 90% of people can be carriers of it and just either not show any symptoms or have very little symptoms, that if they were to transmit it to someone who has a weaker immune system, that they could have full blown, and it can go and become meningitis, the pneumococcal.
Pneumonia.
Yeah. Does anyone have any other questions? Okay, well, thank you for having us.